Hepatitis B is a viral hepatitis, an infectious disease caused by the hepatitis B virus HBV that affects the liver. It can cause both acute and chronic infection. Initially, there are typically no symptoms. In acute infection, some may develop a rapid onset of sickness with vomiting, yellowish skin, tiredness, dark urine, and abdominal pain. Often these symptoms last a few weeks and rarely does the initial infection result in death. 1. It may take 30 to 180 days for symptoms to begin. 1. In those who get infected around the time of birth, 90% develop chronic hepatitis B, while less than 10% of those infected after the age of 5 do. Most of those with chronic disease have no symptoms. However, cirrhosis and liver cancer may eventually develop. Cirrhosis or liver cancer occur in about 25% of those with chronic disease. Hepatitis B virus is one of 5 main hepatitis viruses along with A, C, D, and E. The virus is spread by exposure to infectious blood or body fluids, infection around the time of birth, or from contact with other people's blood during childhood is the most frequent method by which hepatitis B is acquired. In areas where the disease is common, in areas where the disease is rare, intravenous drug use and sexual intercourse are the most frequent routes of infection. Other risk factors include working in healthcare, blood transfusions, dialysis, living with an infected person, travel in countries where the infection rate is high, and living in an institution. Tattooing and acupuncture led to a significant number of cases in the 1980s. However, this has become less common with improved sterilization. The hepatitis B viruses cannot be spread by holding hands, sharing eating utensils, kissing, hugging, coughing, sneezing, or breastfeeding. The hepatitis B viruses cannot be spread by holding hands, sharing eating utensils, kissing, hugging, coughing, sneezing, or breastfeeding. The infection can be diagnosed 30 to 60 days after exposure. The diagnosis is usually confirmed by testing the blood for parts of the virus and for antibodies against the virus. The infection has been preventable by vaccination since 1982. Babies born to mothers with hepatitis B may be offered hepatitis B immune globulin and vaccine at birth. Vaccination is recommended by the World Health Organization in the first day of life if possible. 2 or 3 more doses are required at a later time for full effect. This vaccine works about 95% of the time. About 180 countries gave the vaccine as part of national programs as of 2006. It is also recommended that all blood be tested for hepatitis B before transfusion, and that condoms be used to prevent infection. During an initial infection, care is based on the symptoms that a person has. In those who develop chronic disease, antiviral medications such as tenofovir, entecavir, or interferon may be useful. However, these drugs are expensive. Liver transplantation is sometimes used for cirrhosis. Signs and symptoms. Acute infection with hepatitis B virus is associated with acute viral hepatitis, an illness that begins with general ill health, loss of appetite, nausea, vomiting, body aches, mild fever, and dark urine, and then progresses to development of jaundice. The illness lasts for a few weeks and then gradually improves in most affected people. A few people may have a more severe form of liver disease, known as fulminant hepatic failure, and may die as a result. The infection may be entirely asymptomatic and may go unrecognized. After proper immunoprophylaxis does not appear to contribute to mother-to-child transmission, M to CT of HBV. The virus may be detected within 30 to 60 days after infection and can persist and develop into chronic hepatitis B. The incubation period of the hepatitis B virus is 75 days on average, but can vary from 30 to 180 days. Diagnosis. The tests, called assays, for detection of hepatitis B virus infection involve serum or blood tests that detect either viral antigens, proteins produced by the virus, or antibodies produced by the host. Interpretation of these assays is complex. Screening people who are at risk is recommended by the USPSTF. As of 2020, the hepatitis B surface antigen HBsAg is most frequently used to screen for the presence of this infection. It is the first detectable viral antigen to appear during infection. However, early in an infection, this antigen may not be present, and it may be undetectable later in the infection, as it is being cleared by the host. The infectious variant contains an inner core particle enclosing viral genome. The icosahedral core particle is made of 180 or 240 copies of the core protein, alternatively known as hepatitis B core antigen, or HBcAg. During this window, in which the host remains infected, but is successfully clearing the virus, IgM antibodies specific to the hepatitis B core antigen anti-HBc IgM may be the only serological evidence of disease. Therefore, most hepatitis B diagnostic panels contain HBsAg and total anti-HBc, both IgM and IgG. Shortly after the appearance of the HBsAg, another antigen called hepatitis B antigen HBg will appear. Traditionally, the presence of HBg in a host serum is associated with much higher rates of viral replication and enhanced infectivity. However, variants of the hepatitis B virus do not produce the E antigen, so this rule does not always hold true. During the natural course of an infection, the HBg may be cleared, and antibodies to the E antigen anti-HBe will arise. Immediately afterwards, this conversion is usually associated with a dramatic decline in viral replication. Prevention. Vaccine. Main article. Hepatitis B vaccine. Vaccines for the prevention of hepatitis B have been routinely recommended for babies since 1991 in the United States. The first dose is generally recommended within a day of birth. The hepatitis B vaccine was the first vaccine capable of preventing cancer, specifically liver cancer. Most vaccines are given in 3 doses over a course of months. A protective response to the vaccine is defined as an anti-HBs antibody concentration of at least 10 μ per milliliter in the recipient's serum. The vaccine is more effective in children, and 95% of those vaccinated have protective levels of antibody. This drops to around 90% at 40 years of age, and to around 75% in those over 60 years. The protection afforded by vaccination is long-lasting even after antibody levels fall below 10 ml. For newborns of HBsAg-positive mothers, hepatitis B vaccine alone, hepatitis B immunoglobulin alone, or the combination of vaccine plus hepatitis B immunoglobulin, all prevent hepatitis B occurrence. Furthermore, the combination of vaccine plus hepatitis B immunoglobulin is superior to vaccine alone. This combination prevents HBV transmission around the time of birth in 86% to 99% of cases. Tenofovir given in the second or third trimester can reduce the risk of mother-to-child transmission by 77%. When combined with hepatitis B immunoglobulin and the hepatitis B vaccine, especially for pregnant women with high hepatitis B virus DNA levels. However, there is no sufficient evidence that the administration of hepatitis B immunoglobulin alone during pregnancy might reduce transmission rates to the newborn infant. No randomized control trial has been conducted to assess the effects of hepatitis B vaccine during pregnancy for preventing infant infection. All those with a risk of exposure to body fluids, such as blood, should be vaccinated, if not already. Testing to verify effective immunization is recommended, and further doses of vaccine are given to those who are not sufficiently immunized. In 10 to 22-year follow-up studies, there were no cases of hepatitis B among those with a normal immune system who were vaccinated. Only rare chronic infections have been documented. Vaccination is particularly recommended for high-risk groups including health workers, people with chronic kidney failure, and men who have sex with men. Both types of the hepatitis B vaccine, the plasma-derived vaccine PDV, and recombinant vaccine or V, are of similar effectiveness in preventing the infection in both healthcare workers and chronic kidney failure groups, with one difference noticed among health worker group, that the IV intramuscular route is significantly more effective compared with IV intradermal route of administration. Treatment. Acute hepatitis B infection does not usually require treatment, and most adults clear the infection spontaneously. Early antiviral treatment may be required in fewer than 1% of people whose infection takes a very aggressive course, fulminant hepatitis, or who are immunocompromised. On the other hand, treatment of chronic infection may be necessary to reduce the risk of cirrhosis and liver cancer. Chronically infected individuals with persistently elevated serum alanine aminotransferase, a marker of liver damage, and HBV DNA levels are candidates for therapy. Treatment lasts from 6 months to a year, depending on medication and genotype. Treatment duration, when medication is taken by mouth, however, is more variable and usually longer than 1 year. Hepatitis. Hepatitis B is a liver disease caused by a virus carried in the blood, saliva, semen, and other body fluids of an infected person. Like HIV, it is spread by sexual contact or sharing works to shoot drugs. It can also be passed from mother to baby around the time of delivery. Symptoms may include tiredness, poor appetite, fever, vomiting, joint pain, hives, rash, or jaundice, a yellowing of the skin, and whites of the eyes. Most people recover, but some become long-term carriers of the virus and can spread it to others through sex and needle sharing. Like, subscribe and follow My Health by Dr. J for more health videos. Thank you for watching. Bye.